is a medical emergency, and they're going to describe something like a curtain falling over their field of vision. It's going to literally be like somebody is lowering a curtain over their eye. Sudden floaters, flashes of lights in one or both eyes, blurred vision, decreased peripheral vision, and you need to notify the doctor as soon as possible. So, talking about the patient teaching, how do you know that your patient teaching is effective if you're teaching them how to put in their eye drops? Teach back, right. You have them show you what to do, or you tell them to talk you through it. Or, if you're teaching them how to put on the eye patch or which eye patch to wear, you have them show you how to do it. Okay? Cataracts are pretty simple, straightforward. Any questions about that? Okay. Now, let's talk about eye trauma. So we talked about eye trauma, the three different types. The blunt trauma, and that's when a solid object causes damage. Penetrating trauma is when the eye is actually pierced by a sharp object. And then that hyphema is the bleeding in front of the eye. Remember, that's when you can see the eye filling up with blood. And it's between the cornea and the iris. Your signs and symptoms are going to be mostly the same. Eye pain, periorbital edema, and vision changes. And so what we want to make sure we do here is not to remove the object. We want to stabilize it to prevent further damage until we can get to the hospital where something can be done, okay, or to the OR where they're going to take it out. Questions about eye trauma?
I do have a question. Do we need to know the type of eye drops for this? Or that's not really, is that too in depth that you just want us to know?
That's really too in depth. Now listen, in 10 minutes it says that our little party on Zoom is going to end, so we may have to come back together. Okay, I may have to create another Zoom link and have y'all join it. I would like to upgrade it, but I don't think it will let me this late in the game. Okay, we'll see. We'll see how it does. Okay. So, peripheral neuropathy. This is where we have the decreased sensation, especially in the lower extremities. But remember, peripheral neuropathy, there are a lot of different kinds, and so it can affect many different organs. The one that we associate it with more often is the lower extremity. So our risk factors here go along with a lot of the stuff that we've already seen. Chronic conditions, alcohol use, autoimmune disease. So chronic conditions, we're talking about diabetes, hypertension, things like that. Autoimmune, we're talking about lupus, stuff like that. Increased age, smoking, and then some chemo drugs are going to induce peripheral neuropathy. So some of the symptoms that we're going to be having is decreased sensation, pain, burning. Your patients are going to describe it like feeling pins and needles, numbness and tingling, poor pedal pulses, and then decreased balance because they don't have that sensation in their feet. It's like when your leg completely falls asleep and you're trying to walk on it and you're walking all crazy. That's what is happening here. So your nursing diagnosis, again, is going to be safety related. Anytime that there is a choice for a diagnosis or a problem, it is most of the time, it's either your ABCs or safety. Okay, that's what you have to go by. And if they ever ask you what is a nurse's first action, what is your first action? Assessment. You always assess first. Okay, whether it is assessing your patient or assessing your patient's lab values, you're always going to assess first. All right.